I'll let Senator Pan have a follow-up, and then we'll go to Senator Wolk, because I believe you, are you, is Wolk and then Wynn? Why don't we do Wolk, Wynn, and then we'll go back to Senator Pan.
Assemblymember, I'm having trouble with your bill, and I believe that our staffs did talk about this earlier. The screening, we have required screenings. There's some listed in the analysis, but we've required that. You know, we have long conversations about it, and bills, and we have done that for good reason, and I voted for probably all of them. But I think what I would really like you to do is hold this bill, and I'd love for you to take a look at this issue of handouts and how we actually inform people in a way that doesn't frighten them or that they ignore everything that we're giving to them, which is probably what happens at that time. And I think that that's worth quite a bit of thought and action. But I'm not comfortable with just eliminating the way the screenings are set up and stored at the moment, unless we look at this in a more global fashion. So that's where I am at the moment.
Senator Wynn?
Thank you, Mr. Chairman. I have a question. I'm not sure if it's to the Assemblyman or to the Hospital Association, but the opt-out, because if I remember correctly, when I gave birth to both of my boys, who are 4 and 2, the opt-out was, it was stated to me, if I remember correctly at that moment, was that you could do this and it will cost you X. And so most parents would be like, well, why would I need to do all that if it's going to cost me so much more money to do it? And so if I remember correctly, I opt out. But I never knew, though, that this information was going to the government regardless. So help me understand this. I mean, you know, it was quite, I mean, it was not that long ago, but it is long enough. Help me either, you know, help me understand the opt-out part of it, because I thought it was a cost to it extra outside what you pay for, okay? Then how come I don't remember being informed that this was going to the government data? And I would assume I would think about that as a sitting county supervisor. I mean, I'm really confused by this bill. You know, Assemblyman, I do appreciate it because I like the fact that you're giving the parents more information. But quite frankly, when you're giving birth, there's a lot of information. So already given, I mean, I remember the first one was like a whole bag of just documents. It was a full bag and all these free samples of everything you can think of, from baby lotions to one diaper. I mean, you name it. I remember that.
I remember that too.
But so, I mean, I like the fact that this is going to give parents more power, but how do we make it so it's more simple, like Senator Roth is saying? I mean, I don't remember how many forms there were because there were so many. You know, I don't want this to be duplicates. I understand the intent. So kind of help me. I'm not sure if that's an I mean, I hope it's a question. It makes sense.
If it pleases the chair. So, you know, this bill is numbered 170, and we introduced it in December after the big Newsweek expose came out. And we have thought about this, and my staff has done just a tremendous job thinking about the way to make this the most sensible way. And we thought about a lot of things that General Roth said and a lot of things you said. At every step of the way, the opposition has manifested a willingness to offer criticism about different proposals, but very little willingness to come to the table and think about what might work. You know, I mean, we considered things like mailing every parent so that it's not at a very emotional time. We considered making it at a stage of an ultrasound so that it was a time where it's a little bit easy and you're not going into labor and starting to think about pushing, right? But we kept hearing, well, what about people who are born at home, and what about people who use doulas, and what about people who do this, and what about the cost? And it just seems like there's no thing that would satisfy the opposition on this. But it's such an important concept, right? I mean, the example I started off with, and I'm not sure if you were in the room, if you imagine a senior citizen gave a cholesterol test and that senior citizen found out that the government was taking their blood and then doing experiments on it, we'd have AARP, I mean, we'd have them out the door. There would be people with pitchforks and torches ready to tear down this building, but we're doing this to babies, right? So we have to find a way to get this information out. There are different stages where we do give parents these forms, and I think having that type of very easy to read, simple form is the best we can come up with. And we've considered a lot of these issues, but this bill has been going through the process for a long time now, and we've thoughtfully thought out every different possible thing that we could possibly do.
Any further questions?
I'm done. Thank you for now.
Senator Pan.
Okay, thank you. I have to admit, I'm a little disturbed by some of the presentation because, first of all, the description is saying we're doing experiments on people. Well, we're not doing experiments on people in terms of saying we're going to take someone's baby and start doing experiments on them. And and I think that if we want to, we should think about if we need more rules or laws or regulations about what they can use the blood spots for. Let's talk about that. Like, what should be the restrictions on those? And in fact, one of the questions, unfortunately, DPH isn't here, is knows currently what do they allow people to use these blood spots? I mean, I know they stored them, but what different studies have they actually permitted people to actually tap into these samples for? I think that's a very important question because, as I mentioned, there are some certain types of research I think we would want to support, which would actually benefit everyone, and again, would not put any of the babies, any of the families at risk of information breaches or anything else, any other health issues. So I want to be very careful about, because we go around telling people, well, if we're doing this, we're going to be doing experiments on your kid. That's frightening.
I don't think I said that.
So, well, I'm hearing a lot of that. Okay. The other thing is, for example, you said, well, we're very worried as a civil liberty that people have DNA information. There's not an electronic database that has, even with a identifying number that has DNA, no one's running a whole DNA profile on these blood spots. So
You're wrong. Researchers who I've talked with over the course of this bill.
Hold on.
Oh, I'm sorry.
Let him finish.
So what happens is that, yes, you have I have a database that says, okay, I have tied to vital statistics information, and there's a code number, right? And then the code number attaches to a blood spot that's in a storage facility. But there's no way, even if you hack the database, you could get, I guess if you really wanted to, you could hack the database and then go send a team in to crack into the thing, get the blood spots, and then run what nefarious experiment you're planning to run. I mean, I think we got to be I think we really need to think about really what is the true risk, right? When we talk about data breaches, we all think about Target and some other things where someone actually has personal identifiable information. What they got is a serial number that if you actually got the blood spot, you could actually get to the storage facility to get the blood spot. You probably, unless you actually broke into it with a team, probably the Department of Public, you'd have to explain to the Department of Public Health or whoever keeps that why you're using it for it. And it's not like that there's already a database of hidden information about your child or your baby that they're hacking into. They'd actually have to go get the blood spot, take the blood spot, run it through whatever machines there to get whatever information you're getting. So I think we need to be very accurate and careful in describing what truly is the risk and even informational risk we're presenting to the families. And I just want to be very careful because I'm hearing things like, oh, they can get your data, the DNA information on your child. That's not true. They don't have, you could, I guess, through a lot of work, but it's not going to be very easy to get a DNA profile on a child without a lot of people giving permission in between to get there. So I just want to be very careful about how we're presenting this. And I think we also need to acknowledge there's actually some benefit. I mean, the reason we have the linkage, I think was pointed out, is that sometimes it is helpful to be able to go back and get a blood sample from the time they were born, and thank God someone kept it. Because now, however many years later, someone had a condition, and they're like, okay, well, is there some way we can, and there was so there is a benefit there that I think we also need to acknowledge and talk about as well.
I'd like to make a couple of comments. First of all, Assemblymember, I appreciate your passion for consumer rights and privacy. I don't disagree that, everything's in the web. I mean, Google has more information than anybody would ever want to know, okay? But what I'd like to bring it back to is, what is the purpose of this testing? The purpose of this testing is so that the child that's born, to find out if there's any disease or genetic diseases that can be treated to save the life or to make better for that child. The information is already given to the parent, albeit maybe it's questionable as far as the timing, it being emotional, et cetera. The parent has the option not to do that test, but what is the information used for? So when they get the information, they separate it, they identify it with a barcode, they have the information. My understanding is that it's secure and it's not through the internet, but what is the information used for? The information is used for public good, to make sure we can do research, bless you, so that if there's any potential diseases for society as a whole. So my staff just gave me what the Department of Public Health is allowed to use it for. Shall be stored and made available to any researcher who is approved by the department for the following purposes. Number one, research to identify risk factors for children's and women's diseases. Research to develop and evaluate screening tests. Research to develop and evaluate preventive strategies. Research to develop and evaluate treatments. So I kind of look at this as it's in the best interest for the public good from a public policy perspective. So I understand where you're coming from, but I can't support it this time because I believe that the patient is given the information is stored securely. We have very, very strict federal HIPAA requirements that does not allow anybody to get that information on the patient. It's in a secure site that's not accessible to the public via the internet, and that information can only be used for research purposes only. Now, yes, there's a possibility there could be a data breach or whatever, but I still feel that at this point, it's as secure as we possibly can, and I can't support the bill at this time, but I mean, feel free to close and,
Sure. So thank you. Thank you for the terrific discussion, and I really do appreciate all the comments that are made today. The screening program, which my bill does not affect, is a public good. And I think that even the testing that is done later, the experimentation on the blood, is a public good. But shouldn't we then be advertising this public good? Shouldn't we then be telling parents in the most plain possible terms that we're doing this wonderful public good and allowing them to have that information? Shouldn't we be, because nobody doubts that there's a public good. We could probably stop every car going on the freeway and test them for cholesterol, and we do public good. But as lawmakers, we have to do this tension with what is the balancing of rights and what is public good. DNA is identifying information. The question here is not, does the government have your DNA with the serial number? We are giving blood to researchers, and the researchers then have your blood, and they're testing for genetic diseases, and they can do a complete genome for $99 now. So, of course, a researcher and their laptop, they have people's DNA information on their laptop. We know that for certain. 5 years ago, we couldn't even imagine that somebody would hack into starlets' iPhones and put their private pictures on the internet. We couldn't imagine that someone would want to hack into Anthem Blue Cross to get competitive information about all the people insured in the United States of America. I hope I'm wrong. I hope that this program is not something that, because this is my concern, and this is what I will close with. If there is a high-profile incident, if there is a high-profile hack, if we have done nothing to protect this sensitive information, what happens to the programs then? What happens to the programs that we all love and we all agree do a lot of good? I would submit that the backlash whenever a target or any of these entities has been hacked has been worse than the hack itself. So, I would respectfully ask for your aye vote.
Is there a motion? Lack of a motion, the bill fails.
Thank you very much.
Thank you very much. Okay, who is, yes,
I'm not familiar enough with the rules to know if I need to ask for reconsideration.
You
if
can
there's-
get
Okay, that'd be
reconsideration.
great next year.
Thank
Thank
you.
you. Thank you very much.
Assembly member, we need to verify, because if there was no motion, we don't know if there's a reconsideration, but we need to verify with. But there's no motion. No one even made a motion. It, yeah, it'll be held in committee because there's no motion. I believe Assembly Member, hold on, make sure I got my, Thurman is next. Sorry, I kind of lost track. Did I see Gomez? Yeah, okay, then Gomez.
I think it would be fail for lack of a motion.
Bill for lack of a motion, but there would no, reconsideration wouldn't be necessary, right? Because it never had a.
Good afternoon, Assembly Member. Welcome.
Thank you, Mr. Chair and members. Thank you for the opportunity to present AB 1025. Let me say at the outset that this bill still has amendments that were taken on in the Senate Education Committee. And I also want to acknowledge that we are working to reduce the cost of the programs that the bill speaks to. This bill is simply about providing school-based mental health services to many California children who are in need. The bill would serve foster youth, kids who've experienced trauma, as well as students who need special education services or behavioral intervention services. This bill is patterned on work that's already being done in some parts of our state, but many desperately need. Simply put, when school districts and county behavioral health systems work together to make sure that students can draw down on funds like Medi-Cal, to make sure that students get the services they need to address their mental health needs so that they can learn. So we're honored to bring this bill forward. We'd like to see it expanded to many school districts throughout our state. We have a number of witnesses here who can speak to some of the technical aspects of the bill, including Mr. Rusty Seelix, who represents the Steinberg Institute and the California Council of Community Mental Health Agencies. And I'd respectfully request an aye vote.
Thank you, Mr. Chairman. Rusty Seelix, California Council of Community Mental Health Agencies, Mental Health America of California, and the Steinberg Institute. This bill is designed to expand successful pilots that can transform the relationship between mental health and schools. We in mental health have known always that teachers know who the children are who may have behavioral health problems, but they haven't been partnered with mental health people to make that knowledge transfer into children getting the help in a timely manner. The result is which children wind up in special education years after their mental health problems first start before they get any help. Pilot programs that pair mental health professionals with teachers and help students at all levels are proving not only do they work to identify and treat mental health problems early, but they actually save the schools money because they keep kids out of costly special education. There's been 2 successful pilots, and the purpose of the bill is to have enough pilots so that we think every school and county will want to partner to make this become a norm. It should become a standardized practice, but apparently we need to have several more pilots that are done and evaluated to make the case so that all schools and counties will want to invest in this program, which seems to have tremendous payoff in both health, education, and cost savings.
Thank you. Anyone else in support?
Kimberly Chen with the California Pan-Ethnic Health Network, proud to be in support. This bill goes a long way in helping especially our young boys and men of color who are often underserved in this field.
Mr. Chair and members, Christopher Castrillo on behalf of the California Academy of Child Adolescent Psychiatry would just echo the comments of Mr. Seelix. With the loss of AB 3632, we've long been searching for creative ways to find access to school-based mental health services for our youth. We think this bill does a great job in doing that. We appreciate the member bringing it forward and ask for your support.
Danielle Millay, California Alliance of Child and Family Services, representing 115 foster care and children's mental health organizations, also in support for the reasons already stated.
Brandon Tartaglia with Disability Rights California in support.
Thank you. Anyone else? Opposition. Opposition, please.
Thank you. Thank you. Thank you. Thank you.
Thank you, Mr. Chair, members. Alice Kessler, I'm here representing the SELP administrators of California. We are the school administrators that coordinate special education funding and services. We have an opposed position, but we have been in regular communication with the author's office. The amendments go a long way toward addressing some of the policy issues we identified. And really our opposition only remains with respect to the funding source, which we're going to continue to work on with the author's office. So thank you very much.
Thank you. Any questions from the members? We have a motion by Senator Monning. Chair is recommending a support. Would you like to close?
Thank you. I respectfully ask for your aye vote.
Thank you. We've got item number 12, AB 1025, due pass as amended to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Wynn. Wynn, aye. Hall. Hall, aye. Mitchell. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye.
Thank you, Mr. Chair and members.
Currently as 8, we're going to put that bill on call. We have, I think, one member absent.